Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning, and welcome to Ethical Perspectives on the News. I'm your moderator, Karl Cassell. Many of us believe we need more competition, transparency, and accountability in healthcare, but there exist varying beliefs on how this can be accomplished. There is a growing and aging population and limited resources for the needed healthcare services for every man, woman, and child. Affordable healthcare will continue to be a major bone of contention in the financial, political, and social arenas for at least the foreseeable future. So we will attempt to unpack the ramifications with our esteemed guest today and hopefully offer perspective on how we get closer to those solutions. So to my immediate left, we have Terry Daubitz, who's a social worker here in Linn County. Good morning.
Good morning.
In our middle here, we have Dr. Chris Peters, who is a surgeon and a politician. Good morning.
Good morning.
And on the end here, we have Marianne Hindman Grobstich, who is an assistant professor at Mount Mercy University.
Good morning, Karl.
Good morning. And so let's just, for our viewers who aren't necessarily sure about this discussion about Medicare for All, and all that goes into our healthcare services and the need to lower cost and offer affordable service. Can someone explain, what does Medicare for All or single payer system mean in layman's terms?
Well, do you want to go ahead?
Well, I'll give it I'll try.
Start it.
I basically see it as saying, look at our Medicare for Elderly program that we have now and just extending it to all Americans is what the proposals seem to be, and I haven't looked at them in great detail, but that's what I see it as. So it's a single payer system where the payer is the federal government, ultimately the taxpayers, of course, that fund that. So that's kind of what I see the proposals as looking like.
Okay. Anyone else want to add anything to that?
I think in looking at the Medicare for All plan, and as Chris said, certainly expanding on the Medicare plan that we currently have, but we also, I think, have to look at the gaps that are currently in Medicare with our seniors, their drug coverages, vision, hearing, those kinds of services that aren't covered. I think it's an opportunity for us to start there and really look at how we can provide for our aging population and then expand into, expand the services and to have a plan that's really encompasses all of us and all of our needs.
Perfect. Thank you.
Yeah, and I think, when Medicare was created in 1965, the role was to give back to those older folks who had, dedicated 40, 50, 60 years of their lives into our economy. And our reward as a society was to give them back health care, and it's not going away. So we need to take care of those older folks and ensure that it's there. And my concern is if we're going to go and expand it, gosh, I really hope that we've got it, we know what we're doing, because right now we're not doing it very well.
Right.
And then when they expanded it to include those with disabilities, so we've got a much larger population going on, and I'm not sure how we're going to pay for it.
Well, and so let's expand on this cost piece. You guys mentioned the threat of being able to pay for it. It's single payer. That means our government, which ultimately falls on the taxpayer, being us. Is it affordable? Can it be less affordable if it falls on the taxpayer if we expand it? How will that play? How will the financial ramifications play themselves out?
I'm very concerned about the affordability of the Medicare for Elderly we have right now. Between our various entitlement programs, Social Security and Medicare, both for elderly folks, right now that burden is falling on about 2.5 active workers. Within the next decade or so, it's going to be down to 2 workers. When I was born, that was 5 workers taking that burden. So as our population has aged, more and more people are retired. I'm the tail end of the baby boomers. As my generation retires, the number of people we have to support, that current workers have to support, younger folks. I'm worried about the sustainability for future generations. And and a lot of people are. I think that's not really a partisan disagreement. So if I'm worried about what we got right now, I'm definitely worried about expanding that program further. I don't see how it's possible.
Certainly.
I think the numbers that I've seen is 33 trillion over 10 years is what the cost is going to be, and I'm not sure how we're going to figure that out. That's a lot of money. And then even if we do that, what do we do? Does that mean we no longer have Medicaid? Does that mean, so there's a whole bunch of other questions that we have to take a look at. In working with a number of people who have Medicare, a lot of times those co-payments they can't pay. So they're relying upon a Medicaid system at that point in time to help pay their co-payments perhaps. So if you go straight with the 80-20, a straight Medicare, they're paying 20%. Well, they may not be able to pay that $500. Well, if everybody has Medicare, what's left? How's that 20% going to be covered? And so $33 trillion over 10 years, that's still not going to cover the costs. I'm not sure that that's going to be effective.
I think that anything that means something to us, we invest in. If we want a nicer car, if we want a nicer home, we take our resources and we invest in that. We shop, we choose, we select. So I think currently when we look at our healthcare system, that's a piece that I think we have to expand our vision to do. When you look at what Medicare for All looks like in the most recent, and that's ever changing as well too, but I think in the most recent conversation that I see, they're saying no copays, nothing. It would be 100% covered and very inclusive. So then we would have to look at what we're normally putting away for our premiums each month as probably a tax. That would probably be a tax as well as some other taxes to cover the cost. So whatever we do, we're going to have to look at it differently. And I think it's really, really important to bring the right people to the table to have the discussion and to make the decision. I think that's physicians, I think it's patients, I think it's industry, I think it's small business owners, I think it's academia, I think it's nurses, I think it's the whole piece. Because even now when we look at our physician shortage and our nursing shortage, what would that look like with Medicare for All? Would that be better or not? So there's so much that has to be part, I think, of the dialogue and the next step.
You bring up a great point about bringing all of the partners and players to the table. Let's talk about insurance companies. How do they feel about this? And is this approach good for them or not? But let's first talk about the insurance companies and then the hospitals and physicians per se. So.
I don't have a comment. I just wanted to go back to that idea of bringing good people together. And I agree with that. I think the four of us could probably come up with a reasonable
Absolutely.
plan.
I think we'll go out as a contingent and make it happen.
Give us enough time and maybe some beer. We might get there. But the problem is this always goes back to our political system.
Certainly.
And unfortunately, politics of the day is all bumper sticker politics. You have repeal the Affordable Care Act on one side, Medicare for All on the other,
sound bites.
And there's no discussion in the middle. And I think there are solutions here. I favor a system which I shared with you guys beforehand that's more patient-centered and market-driven. I think that would actually work. But even if I got you all drunk enough that you agreed with me, if we brought those forward in our political system, unfortunately, I think it gets it's not going to go forward as we want. And then going back to the various industries, like you mentioned, insurance companies, hospitals, pharmaceutical companies, American Medical Association, other medical groups, nursing groups, et cetera. Everybody, even if we move it all to the federal government's plate, it's not immune from politics even there. Politics is even probably more involved there once we move it to a regulatory agency than it is even in our run-up to the Iowa caucus, which is hard to imagine.
Right. Anyone else?
No, I think that whether we're Democrat, Republican, Independent, we have to lay all that aside and look at what our patients need and what our communities and societies need. This is our chance to pass this legacy on to the next generation and to have a better healthcare plan and better coverage and better, a healthier society all the way around. I mean, back to your point about insurance companies, Karl, obviously a private insurance company, that's going to be a huge change for them. But I do think what it creates, Medicare for All, is the need for more patient navigators, case managers. Could our insurance companies transition to that kind of a role? Because they've been doing some of that now. And so could we take some of those industries now and the expertise that they've developed and continue to build forward with something that's going to be all-inclusive and encompassing?
And just on a side note, you mentioned patient-centered care. So should this be approached more from the standpoint of prevention? Let's deal with things on the front end instead of it being, well, you get sick, you come in, you get treated. How would you explain that when we say patient-centered care?
Well, for me, I just want patients being able to be in the driver's seat and making decisions. I know there's a lot of people that don't think they're capable of doing it. I have nearly 30 years of experience as a physician. I think people are plenty smart. And I think it's up to those of us in the healthcare field to make sure they're educated to make good decisions. But ultimately, they need to make decisions for themselves rather than letting a government bureaucracy or an insurance company or whoever make the decision for them. So that's really what I mean by that.
Gotcha.
As to preventative care, when it comes to medical issues, for the most part, we can't do much there. Now, it's different when you're talking about things like mental health, for example. I think there's a much better role for that. But healthcare, Western-style medical care is very good at treating acute illnesses and injuries. We're reasonably okay about dealing with chronic stuff. But prevention, there's not a whole lot of value for most of what we do beyond things like vaccinations.
Certainly.
And I don't want to get into that controversy.
That's for another day.
Yeah, because that could be
another
pretty
day.
controversial. Anyone else want to add?
Health
anything?
literacy is so important, and I really agree, Chris, with obviously it's all about the patient and what's in there. If we ask ourselves, is this the right thing to do, and does this make sense? I think that takes us to a really good starting place when we look at cost and revenue and quality and accessibility of healthcare. So I think it's really important that we're educating our patients ongoingly about the system. And even when you look at a patient being discharged from the hospital, what does that discharge plan look like? Oftentimes that patient is so weary from being in the hospital, they tuck those papers in their bag, and it may be a day later, and by then they've missed a medication or a follow-up appointment that was supposed to be scheduled. So I think that we really have to look at the opportunities to really educate the patients and set up great services for our patients. If it's home health care, if it's counseling, if it's family support, perhaps some skilled nursing care, but look at what we have and how can we most efficiently help that patient achieve their goals, and obviously listen to the patient and define what those goals are.
Bring up something that strikes me as a positive in this. When you start talking about the certain roles that could wrap their arms around the patients, and you mentioned earlier the need of doctors and nurses, but when you have other healthcare professionals, would that be a benefit to the shortage that we're seeing right now with doctors and nurses, having some of the other healthcare professionals being able to fill those gaps to give, obviously, our doctors and nurses who are seeing patients regularly more time to really address some of their higher end needs? Any thoughts?
Well, we really, as a social worker, I'll do our big plug for the social worker.
Absolutely.
We do a lot of that discharge planning. That's our role. And unfortunately, we're moving people through the healthcare system very quickly. You go into the hospital, you have a hip replacement, you're out in 2 days, you go.
Exactly.
So our role is going to be to meet them at that discharge, and where are we going to go from there? And have you gone and picked up your medication? What's your follow-up? And when are you going to see the doctor next? And I'm going to pick you up at the hospital. Sometimes outreach social workers, that's what we do. We go and we pick them up at the hospital. We go and we pick up their medication. We take them home and we say, okay, I'm going to be here tomorrow morning at 8 o'clock to ensure that you get to that doctor's appointment. And I'm working in mental health, so that's a little bit different. But really our role is the same, is to ensure that we are that continuum of care. And as long as we can keep them healthy, then are we going to keep them out of the hospital? And that should be our ultimate goal, because that's costly. That costs a lot of money to do that.
Absolutely. Anybody else?
Yes, well, speaking, I'm sure this is probably similar for nurses as well. My wife's a nurse, and so I hear it a little bit from her, although she works in my clinic now, so a little less. I think she's pretty happy. But prior to that, when she was still a hospital nurse, there's a lot of burnout among healthcare workers, and probably true in social work as well. But and there's a lot of factors to it, and at least for physicians, one of them is dealing with these really complicated electronic health records, which really don't add much beneficial to most patient encounters. There's some good elements to it, but a lot of it's a really large billing package for hospitals and clinics to make sure they get reimbursed, and so we're doing kind of stuff that isn't basic to being a physician or being a nurse or being a social worker. You're staring at a screen, and it gets a little old. Again, there's a lot of different factors to it, but I think reforming our healthcare. The one thing I'm not arguing for is the status quo.
Right.
The way we do our healthcare right now is woefully inadequate. Again, I don't see either Republicans or Democrats bringing anything meaningful to the discussion. Like this, again, it's going back to that bumper sticker politics. I think there are solutions out there. I think we can agree on some fundamentals. I like to refer them as the ABCs of healthcare: access, benefit, cost. I want to see every American citizen have good access to healthcare. I want it to be as beneficial to them as possible. I want it to be as cost effective as possible. I think everybody can agree on that, regardless of Republican, Democrat, or Independent. The question is, how do we get there? So let's agree on goals, and let's figure out how to get there.
Well, I think one of the other things that we need to take a look at is, are we educating people on how to best use their benefits? Are we teaching people that there's urgent care options, that they need to go to their family doctor? Do we need, what are some, asking for the generic brand medications? I mean, those kinds of things we need to educate. I mean, as they're consumers of a product, do you know what this really costs? Because a lot of times the emergency room is very convenient, but can we teach you to go to an urgent care? And I'm surprised at the number of people, when I was working for some Medicare patients in the past, who didn't understand what an urgent care was. And so my role was to teach them how to utilize urgent care, because it was cheaper. So.
Any other thoughts?
No, I certainly agree with the conversation. I think, Teresa, back to your role as social worker, that kind of role is going to be even more vital if we go to a single payer system, helping patients, again, navigate the system and get through the services that they need. I also, in terms of professions and providers, could a single payer system incentivize nurse practitioners and DNPs to be part of our provider system for the gaps? Especially, we have to think about our rural health care. We live in Iowa, 99 counties, 87 are rural. What does that picture look like? What does telehealth look like if we go to a single payer system? So there's all these opportunities, and we are fortunate in Iowa that we have a rich state and so many resources and so many people that are very invested. And I think, again, really bringing to the table, I think we had kind of a tough lesson we learned in the changes we made in Medicaid. It was quick, and we had 4 companies, and it got very chaotic. And I think that we can learn from pulling back a bit, and as we make changes, being more deliberate and moving forward in a more purposeful way.
Before we get to the pharmaceutical, some of the other issues, let's talk about, you bring up electronic medical records and doctors being forced to look at screens and some of those things, the rush to do what we did in our state. Can we trust government to really do this correctly And if so, is there the potential of government doing it wrong? But when we look at things like electronic medical records, a much greater emphasis put on tracking people and allowing that to cause maybe rejection of care or just other issues that might arise that people are already concerned about letting government more so into my private life. Any thoughts from any of you?
Yeah, I don't think government's going to be good at it at all.
They're not right now.
I don't think they
It's
are
not
now, and
working.
I don't think that's going to change. It's interesting that we're talking about this today because you may have read that the Finnish government just collapsed today. They were trying to put forward, I mean, the government did collapse, but the ruling coalition resigned, and they were trying to put forward some needed reforms to their universal health care plan and Social Security, and couldn't get it done. And people say all the time we should take lessons from other countries regarding their health care, and I don't disagree. But the lessons we're learning from a lot of these countries is it's not working nearly as well as Medicare for All proponents argue. Canada, its wait times to see a specialist are 10 weeks on average, 2.5 months. Now, for some things you'll get in there sooner, but on average it's 2.5 months. And then from seeing a specialist to getting treatments in another 2.5 months. I don't see Americans putting up with that
We
at all.
can't wait 15 minutes in the line at Starbucks, so we are not going to do that.
Exactly, a very good point. We're an impatient lot. I think we need to look at, again, in my opinion, rather than empowering a group of experts, so-called, at CMS to figure out how to do this, we need to empower everyday Americans.
Well, and the restrictions that
and
CMS
all the providers
has and the reimbursement rates. I mean, the reimbursement rates are not covering the costs of the physicians, the hospitals. They're going to lose more money. And the regulations that Medicare and Medicaid and CMS as a whole has for providers, the hoops you have to jump through, we just can't give quality care anymore. We've got to dot all of these different forms that really, whoever reads them. I do progress notes, and I look at who's going to read this. Nobody's ever going to read that.
5 pages of nonsense for one paragraph you need to know.
Absolutely, and then it's got every HIPAA line on the bottom of it.
Mary, anything?
It's so interesting to talk about where we are now, and we have some real good things in our healthcare now. And I think it's important to really think about what we're doing well and how do we move that forward. Where are the gaps? It's our most precious commodity, our health. And we talk about health care. The second half of that word is care. So how are we caring about each other as people? And what can we really do to extend that? And I think that's so important. We're a bit greedy, us Americans.
Yes, we are.
And we want it now, we want it the best, we don't want to pay for it. And so all those things. So I think to step back and really look at the value of who we are and what we have the ability to do for each other is so important. And that's why when we talk about, is government going to do this right? Nobody's going to do it right on their own. That's why we all have to come together and bring our respective disciplines to the table, and perhaps have some sort of a healthcare summit and put things out, put it out there so that we can all create the best product possible. Now it's an ongoing process. That's what healthcare is. We're not gonna, in 2 months say, here we are, we've got it. But it's a process, and we have to be patient and deliberate as we move it forward.
Certainly. So let's talk about drug prices. A lot of individuals are feeling the prices continue to increase. Should the drug prices be negotiated? Is there a way to make them affordable? And if someone would, if they could quickly and briefly, kind of talk about the Federal Acquisition Regulation, Part 15, the FAR. But let's first talk about negotiating drug prices.
Well, I think it has to happen. It absolutely has to happen. I have a 96-year-old mother who is on Medicare. She has a supplement, and she pays $400 out of pocket quarterly for her medications. Wow. That's not right.
Right.
So I think we have to really look at our drug costs and, again, bring those people to the table and say, why is this medicine that was, $25 2 years ago now $525? And what happened there? And also I think we need a lot more education about generic medications. Those can be very cost effective. And so how can we know more about that? How can we use those more? How can we, help our patients understand more about what they're taking and why they're taking it? I think even, we look at how little nutrition education
Certainly.
people, our medical students have, our nursing students, and we know more and more about our diet and what we eat and how that prevents disease or helps our diseases. And so I think that's another whole avenue that we can really explore that could really make us be a healthier world.
Certainly. Anyone else?
So, pharmaceutical prices, that's a deep hole. So we've only got a few minutes, so I'm not going to go into it very much. But it's, the bottom line, prices are way too high. For every medical service, there is not just pharmaceutical prices. Question is, how do you get them down? I'm a market guy, so I believe in more competition, transparency in prices. That's what brings things down rather than a government edict. That said, for Medicare Part D, we're providing a benefit for seniors for their drug pharmaceutical needs. If we're going to do that, then absolutely CMS should be allowed to negotiate for drug prices.
Yes.
But that goes back to, again, politics is everywhere. Why haven't they been allowed? Well,
Right.
big money in the pharmaceutical industry, right? Healthcare industry broadly and the financial services sector, the two most influential lobbying groups on the Hill.
Yep.
So if we're really expecting a good answer there, I'm skeptical. But more transparency, we should look at reforming our patent laws for pharmaceuticals, encouraging more competition between pharmaceutical companies, going after some of these companies that really do jack up the prices to totally unreasonable levels. It's pure greed. Going after them, we have laws that can do that. We just need to have the political will to do it.
Yeah.
Certainly.
Enforce it.
Anything
No,
in
that's good.
conclusion? Okay. Well, I appreciate each of you and the expertise you bring to the table and the work that you've done throughout your careers as well. Obviously, we can't solve this in 30 minutes.
After some beers, we'll get
But
it.
I think if we come back together with some beers, we might be able to make some headway. So I want to thank you guys for being my guest this morning and adding to this conversation.
Thank you.
Very much appreciated.
Despite the political wranglings and sometimes unprecedented rhetoric, the most consistent factor in this whole process is you, the client, the consumer, and the patient, Figuring out how to best care for those who require health care at an affordable rate will be best suited for those who are willing to put the health of the patient above profits for either government or corporations. I pray that the leadership contingent will step forward and provide a path for all of us. Thank you and good morning.